Hi everyone, I'm Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be talking about a method that you may have heard of, elimination communication. Basically trying to put your baby over a potty before they're ready to necessarily get potty trained at the traditional age of 2. If you're curious about this method, make sure you listen on. Alright guys, let's talk about elimination communication. Now, as I mentioned, it's a way for caregivers to respond to their infant or baby's natural hygiene needs without the use of diapers. You may have heard of this as infant potty training or even natural infant hygiene. I've heard that term thrown around too. Now that means that the baby has to communicate their need to pee or poop in some way and the parent immediately responds. That communication can be anything from squirming, crying, maybe grunting, and then the parent immediately picks up baby and holds them over the toilet, for example. So now this is really important to understand because it's called infant potty training, but really the infant is not holding their urine or stool. In fact, that's not really possible at this age. Elimination communication is essentially exactly like it sounds. The baby communicates those needs, or the parent picks up on those subtle signs of communication and the baby is able to pee or poop. But there's no holding that urine or stool for long periods of time, like in traditional potty training. Now, because of the sort of comfort that your child may already have with sitting on the potty, or for example, you've already been very tuned into their signs of needing to pee or poop and the signs that they're showing outward, then perhaps potty training will actually go very smoothly and very quickly compared to perhaps the other children in their class at the time that are learning to potty train. But that's one of the actually pros or said benefits of elimination communication. Let's talk a little bit more of other benefits that are proposed. Now, by using this method, it's thought that both the baby and parent are able to bond and communicate in a completely sort of different level. There's a completely different level of trust involved here. It's also said to help baby gain self-esteem. Now, aside from that, which I think can be sometimes a little hard to prove, there's definitely the more practical benefits, right? So you're not spending money, tons of money on diapers. There's less waste created, much easier transition to potty training theoretically, as I've already mentioned. And perhaps it might be even easier to travel with your baby. I mean, the flip side could also be a con. Obviously, it could be difficult to travel with your baby if you're out and about and all of a sudden they need to pee and poop and they're not in a diaper, or you might need to rush to the grocery store's bathroom with your infant to find a potty. So obviously there are some practical benefits. There are some more emotional support benefits that are touted as well. I do think that it's a lot of responsibility for the parent. Ultimately, you are learning to act on your baby's needs somewhat soon, fast, immediately, drop everything and do what you need to do. But if you think about it, diapers were invented in 1955. So 3 to 4 generations ago, perhaps this is exactly what used to happen. In fact, in 1962, a pediatric developmental specialist was the one who put out a paper that said ideally between the ages of 2 to 3 is where a child should begin potty training based off of physical and psychological milestones they've achieved. So prior to 1962, this is kind of potentially perhaps how potty training used to progress, especially if the disposable diaper wasn't invented until 1955. That being said, cloth diapering was still possible, but as more families have begun to move, more parents are out of the house, working, etc., there's other child caregivers involved with nannies and daycares. Definitely, I do think that diapers have a purpose in this world for many families and their kids. But on that note, there is a considerable amount of waste, so there is a theoretical benefit to decreasing waste, for sure. A very practical benefit to decreasing waste. But what are the drawbacks? Now, I've already talked about one big con, that this is not potty training. It's just tracking body patterns and putting your infant on the potty, but they're not necessarily learning to pee or poop, or more importantly, to withhold and retain that until the appropriate time, which is one of the hardest parts of potty training. I've already mentioned that it might be less convenient when you're out and about, right? This is one of those like gray areas where it could be a pro or a con. But another thing to think about, and perhaps you're a parent to multiples, or maybe you're a working parent, that it is a little difficult to be able to give your child that immediate attention when they need it, especially in the infancy age. So this definitely requires a lot of, especially initially, caregiver attention. And perhaps this might be easier for some parents with their first child. Maybe it's going to be easier. I've heard definitely stories of parents who've done it with, their second, third, fourth child and said, I wish I had done this with my first. So maybe it definitely is possible. I'm not saying it's not. I just think that it could definitely be a lot harder if you do have other children in the picture. Another thing to think about is possible other caregivers in the picture, right? So maybe grandma, grandpa might be less likely to do this. Maybe your nanny or your daycare center may be less likely to do this. Some daycares may even ask their child to be potty trained before they're put into the 3-year-old preschool class. So some daycare centers may be less likely to help you in achieving your elimination communication goals. And that's something to think about. Now, I do want to talk a little bit more importantly about what are the important physical milestones to potty train, because that makes a big difference when it comes to understanding the drawbacks of potential elimination communication. So first off, in order to be independent in bladder and bowel control, your child needs to be able to sit up, right? So sit upright on the potty. They need to be able to have good sphincter control, right? They need to be able to hold their urine or hold their stool, which infants are not doing yet. And they do need to be able to understand that urge. Now, again, some infants can understand that urge depending on the age group, especially, if they're able to grunt before stooling, perhaps they do understand the urge. But with urination, it may be a little less difficult to pinpoint when your child's going to pee. Now, fast forward to when your child is ready to potty train. On the flip side, even though we know that there's a benefit that it can help you transition into potty training, some occupational therapists have noted that children may be less likely to potty train and then have issues with constipation and withholding when it comes time for your child who's been using elimination communication to then transition to full-on potty training. Now, one of the biggest criticisms is that it doesn't work or it's not important, and I want to dispel that right now. There are a lot of cultures and traditions out there that actually do this early on, so we do know that it does work, and it might work for many families and many cultures based off of the family traditions that you grew up with. So I do totally believe that this is all about perspective and education. I will tell you that I have never done this with my kids, and I'm fine with that. I'm okay with that. I think that this is a daunting task to take on for me, but for other parents, I'll applaud them if they choose to do it. I also want them to know that if it's not working out well, they can pull back. And that's really important too. If the child is resisting, make sure that you don't ignore those signs. So from all of this, I hope this was helpful and educational, but the most important thing I want you to know is this isn't something that truly potty trains babies. It's simply something to help parents facilitate and understand their baby's bodily functions, and then help to potentially communicate that to them. Again, not bringing diapers into the picture at all. Something else to consider is nighttime. And that's something that for many parents, they'll have to think about themselves, that if this is something they choose to do, they have to either go, kind of all in or not do it, because it does sometimes send mixed messages, I feel, if you are doing this during the day but then not at night. So perhaps it's a daunting task for you to take on. Perhaps it's something that's actually gone really well for you. If you have questions or if you have insight into elimination communication, drop some comments down below. Let me know if this video was helpful. If it was, give it a thumbs up, share it with someone else. Have a good week, everyone. Bye.